I'm the community engagement facilitator for.
This
for
is our
Boston
disembodied
Villages.
voice on
Yeah,
the
yeah, I'm the one who called. Yes.
Nice to meet you
You
in
can tell by
person.
my voice, I'm sure. Okay, I'm just gonna call Alex real quick.
Okay, perfect.
And put him on speakerphone. It's not the best speakerphone, but.
Hey, can you hear me?
Yeah, I can hear you. You're on speakerphone in the Board of Health meeting. I'm just gonna put you in the center, okay?
Okay, great.
You want to just introduce yourself real quick?
Sure, sure. Hi, everybody. Thanks for including me. My name is Alex Wally. I'm a general internist and addiction specialist at Boston Medical Center. And I have a role at the health department as the medical director at the Bureau of Substance Addiction Services. I take care of patients in the primary care setting, in the hospital, at BMC, and also do research on overdose prevention. One of the projects is the Healing Community Study, where I'm the care continuum board director. So I understand that you all are considering certain service programs tonight, and I'm happy to provide my input on try to answer any questions that you have. So thanks so much for having me here.
Yeah, we can hear.
Okay,
Thank
cool.
you.
Thank you.
Wonderful. Yeah, so tonight we are going to be looking at ratifying mobile harm reduction services in Ayer. There's a specific process that we have to follow for that, which is bringing it to a vote using the exact language cited in this local control letter sample that I have here. So we have to make a motion to approve harm reduction services for the town of Ayer. And then once that's completed, we will send a copy of the local control letter on town letterhead with a copy of the certified minutes for tonight's meeting, showing that a vote was taken in support of syringe services, mobile harm reduction services, and that's going to go directly to the Assistant Commissioner of and Director of the Bureau of Infectious Disease and Lab Sciences. That's Kevin Cranston. So that is our process for today. And then after that, we wait for DPH acknowledgement and approval, which should be less than 90 days.
And the location for setting up the mobile clinic, you're aware of the location that was volunteered?
Yes, so Stone Soup Kitchen Ministries volunteered there, or Stone Soup Kitchen now, volunteered their parking lot locale for at least a starting place for it.
Okay. So I
Which
think
we could-
location is important to the members of the board in terms of where this would be. And
Yeah.
we had informally talked about, we're good with that spot, but in terms of a decision to do it someplace else, I think you'd want to know about that before that happened. Is that correct?
Why, is that
Well,
something
there
that
was-
happens, or is it always the
I don't
same?
know, but there was conversation about this wouldn't be something that would be parked on the main street of the
No.
town of Ayer.
Right.
I don't think that probably wouldn't happen. I think we talked about it in Townsend at one point, and they said that they would be open to having it at like the EMS,
Sure.
kind of parked outside there. That might be a
Makes
place.
sense.
Yep.
Probably not at the police station. That's probably
No.
not
It could be
a.
intimidating.
Yeah. But like kind of like a safe place, but maybe like off, out of direct lines of sight is usually they're very discreet. Whoever would be doing it, JRI is super tactful about that kind of stuff too.
So once you find a site that you've mutually agreed on it, usually that's it, that's where you stay.
Yeah, and I
Pretty
think
much, and that seems to make perfect
Right,
sense.
the Stone Soup
Yeah,
Kitchen was
yeah.
the location.
So we can let DPH know we've already identified a place that's willing to have it, right?
Okay.
So that'd be Stone Soup. I think as time goes on, if there are other areas of need that are identified in town, like, oh, this is a place that maybe your services, maybe people can't walk from wherever in the town of Ayer to Stone Soup, like that is, this would be expected to be kind of a continued conversation, something that I'm happy to help with. I know you guys are super busy, but just if there's other places that are like, oh, this place might benefit from having those services, we can talk to JRI about that and maybe see if they want to add an additional site or location in town in addition to Stone Soup. But we'd start there at least. It would be a good starting point.
Yeah, I mean, I have a little bit of a concern with Stone Soup. I think it's a great location, and I'm thankful that they offered. On the other hand, though, it's almost
Yeah.
on the border of town.
Yes.
And there's really, it's not in a walking route, really.
Correct.
You wouldn't tend to be walking out there. So I was a little concerned about that and just kind of monitoring, is that the best location to benefit the most people, or could it be, say if they come every week, could it be in every other week if we could?
Yeah, alternate
Right.
site?
Yeah, if we could find something, I don't know what the right location would be, but that's not as close to the actual border of town.
Yeah.
Right.
Yeah.
Yep.
Yeah,
That
no-
would. That's a really good point. I think it's a good starting point because they volunteered. Like,
Yes,
heck, okay.
definitely,
And
yeah.
we know that people who are high need tend to frequent that area.
Yeah,
So from that perspective, I'm like, yes. I also hear you, though. It is definitely out of the way for a lot of people who might otherwise be utilizing it.
yeah, exactly.
Would EMS here in town make not more sense, but also make sense? Or make sense from a location perspective, as far as you know?
I think, I don't know, my feeling is maybe something, not necessarily in the center of town, but closer to the center,
Yep.
or to the West
Yeah.
Main Street
Yep.
area,
Yeah.
or,
That, I'm trying to think, EMS does make sense.
I think there's limited access though, Trish.
That's what I was just gonna
Yeah.
Right, and obviously that would have to be a
This-
conversation
that
with EMS
driveway.
before.
Yeah.
The fire chief, but
Yeah.
the front of the building is the bays to get the equipment out.
Right.
And
Yeah.
Right.
the side of the
Oh yeah, they
building
don't
is-
really have anything around the side, do they?
No, there's parking on the
Right.
side, there's a lot in the back, but it's usually pretty busy.
Okay. Okay.
Yeah, I mean, I think a lot of the time the organization helps, like, works with the Board of Health and the town to identify places.
Sure.
Yeah.
So, like,
Yep.
this is
Yeah.
kind of like.
Because
down-
every
down the
town
road
is
in
different,
ways,
right?
but-
Of course.
Exactly.
So, yeah. Mhm.
Yeah.
Well, let us know too, if
Okay.
Yes.
you have any,
Yeah.
start
yeah.
to develop any feeling for this would be a good, geographic spot.
Yes. Do you think from would Terry or anybody who is doing outreach
Terry
work maybe
probably
have
would
a good idea? Okay.
Yeah, I can
All
ask
right.
her.
That would be great.
One of our
yeah.
recovery coaches probably has a good idea of like some other locations
Yeah,
that she
yeah,
goes
exactly.
to a lot. Yeah.
Yeah.
Okay.
Now,
Wonderful.
will there be an announcement when the vehicle or the van comes to Ayer for the first time?
Would you like there to be?
I would like personally to see, I'm a pharmacist. that's my
Yes.
background.
Yeah.
I'd love to see it.
Yeah.
Okay.
Yeah.
Great.
And have
Yeah.
a better understanding.
Yeah.
Yeah.
we can work with JRI to make that happen.
Yeah.
If it is, we're pretty sure that's going to be JRI, but we know DPH will enter into some sort of a contracting process to pick the
Yeah.
best fit vendor, and JRI has said they'd be very interested in doing it in this area.
Yeah.
And I believe, did I pass on the JRI's program of services and their mobile harm reduction thing to you
might
a
have,
few
but
weeks
I don't-
ago?
I don't recall it, Jen.
Okay, that's okay. I'm going to email that to you again.
Thank you.
Yeah, they have a whole cadre of things. It's not just which is nice.
Right.
Yeah, and I think they would be open to talking with you all too. Before.
sure,
yeah.
sure,
So.
yeah.
All right, so JRI.
Is there specific language you need in the motion to approve this, or?
Yep, so,
So I'm so sorry, people.
It's okay.
It's okay, my landlord's calling me right now. Alex, are you still there?
Yes, I am.
Okay, cool. All right, just making sure. Nothing yet, but I appreciate your existence.
All right, I'm here.
All right.
So,
yes, we are voting on
do you have
June
that?
27th to allow a qualified and appropriate organization to operate a mobile syringe services program in the town of Ayer.
Yes.
Yeah.
Can we-
Pass it over and we'll just
I
make
think
it
I have
into the-
I'll just point to where it is. I don't have a highlighter or anything.
That's okay.
All right, so taking a vote on the date to
Okay.
that part there. Great.
Anyone volunteering to read it? Or-
Sure.
Okay.
Yeah.
She's the secretary, so
Dear Mr. Cranston, we are pleased to inform you that the Board of Health of Ayer took a vote on June 27th to allow a qualified and appropriate organization to operate a mobile syringe services program in the town of Ayer. Attached, you will find the minutes from that meeting to reflect the vote. We look forward to sharing further guidance with the members of the Board of Health as to how MDPH will move to establish a mobile syringe services program in Ayer as one of the allowable programs in the Commonwealth. Thank you for your support.
I guess what we need to say is you make that motion to,
We moved
We-
to
Right.
approve
approve. right?
this, yeah,
So-
I'll make a motion to approve
The mobile harm.
what you just said.
Exactly.
yes.
Exactly. Okay, motion's made and seconded for the town
Yes, I
to
second.
engage in the mobile, okay. As stated in the
As
letter.
stated.
Yes, yes, yes.
Any discussion?
No.
No?
I think so.
All those in favor?
Aye.
Aye. So,
I just-
official
They're
vote.
both-
Yeah, I just want to say one more thing.
Yeah.
For people that are going to see this again
Yes, that's
and
fine.
that watch the meetings, that it's not about the word syringe.
Mhm.
It's much more than that.
Yeah.
It has a lot more services on board that we just want to make that clear to people that are listening. And the stigma of just hearing that, people might be
Mhm.
thinking
Yeah.
the wrong thing.
Yeah.
But
And usually, if you've seen syringes around, like, discarded, they take more in than they ever give out.
Yeah,
So
that's
it's more of a place to take
Right.
care of the syringes as
Yeah.
well. So.
Right.
Yeah.
I think
Yeah.
anything that we can do that helps people that have an addictive problem is a benefit.
Yeah.
Well, anything we do along those lines really is an improvement
Yep.
in public health.
Yep.
Great.
So that's the driver for me.
Did you hear all of that, Alex?
I did.
Okay. It was approved.
Excellent.
All right.
Congratulations.
Yeah.
Fantastic.
Awesome.
Thank you.
Thanks, Alex.
Yeah,
Thanks for
thank you.
everything you do.
Thank you.
All
Thank you all
right.
for your-
Awesome.
Happy to see you. Bye-bye.
Bye. Thanks,
Bye.
Alex.
So in the meantime, we have some flexibility, even though we just voted that, yes, we're going to do this, and it's going to start out at Stone Soup. But in the meantime, if there's another alternate site,
Yeah.
in the bigger towns or the cities, there's probably more days added on the calendar
Mhm.
and different locations. Is that, I'm assuming?
I would guess that, yeah.
Yeah.
Like I think about Worcester, like
Oh,
yeah.
yeah.
Yeah,
all
that's
over the
all
place.
day, every
Yeah,
day.
yeah.
kind of thing.
Yeah.
Yeah, I think starting small and sort of like easing into it, I think that's probably the best way to go. And
Right.
yeah, I think I'll ask Terry to see if she can tell us some other places that she frequents.
Okay.
It is more spread out here, so it's
Yeah,
like,
it
It
is.
is,
That's the
yeah.
issue.
Yeah.
That's the challenge. But yeah, Stone Soup's kind of far.
But we are at least
Yeah.
a small town,
Yeah,
area-wise.
yeah.
We're
Right,
not like
this
a
is
Groton or
true.
a Harvard.
It's
Yeah.
walkable.
Yeah,
Mhm.
yeah.
Yeah.
Yeah,
And
most
having
of it is, I agree.
having the services in town is closer than having them in Fitchburg,
Yes.
right?
Absolutely, yeah.
Which
So it may
also
not be
exactly.
ideal, but it's certainly miles better, literally.
Exactly.
Yeah,
So-
literally. Yeah. And you're also now like miles ahead of Fitchburg too.
That's
like,
true because they
yeah.
don't have them.
Yeah,
Really?
they're like
Syringe
shutting down.
services.
Like
Yeah.
they're
You
shutting
guys
down.
are leading the charge.
Yeah.
I'm really
I'm
surprised.
Well, there's-
Yeah.
So am I.
They have like sober homes and like halfway houses that they're closing there. Like
Really?
yeah, they're like shutting them down, which is not good.
Not good.
Is that, why? Is
I
it
just don't think they want
resident
them there.
feedback?
Yeah,
kind of?
maybe
Yeah,
neighbor
yeah.
feedback.
Yeah,
yeah.
Yeah, it's difficult.
Yeah, it's
Yeah.
a different, it's a
Staffing
different
is-
culture.
Staffing is huge, and I hadn't
Yeah.
heard really great things about the two places in Fitchburg that I know of. There
Mhm.
was such a huge turnover in police activity, so
Yes.
Yeah.
Yes.
revolving door kind of thing.
Yeah, it's
Yeah.
it's definitely a challenging place.
Yeah.
But this is like really central to like a lot of the work that the study was in, right?
Yes.
Townsend and Shirley, but
Yeah.
also like so this is really great because it's centrally located to like the whole Middlesex region in
Yes.
some ways, North Middlesex region.
Yeah.
So
And you guys have quite literally put this region on the map. Like literally
Yeah.
that map that I showed
Yeah.
you guys,
Yeah.
Awesome.
you're gonna be on it now, and that's
Yeah.
really cool.
That's great.
It is.
So
yeah.
how do you get the word out? How have you gotten the word out in other towns? Do they?
This is the first town.
Yeah.
You guys are leading the charge in
No, I
this
mean,
region.
JR.
I thought there was one, when we talked about, there was a gap in services, and you showed us the map,
Mhm.
but I mean, like Lowell or Lawrence.
Yeah, they have their own. Whatever organization is chosen, they have their own like method and expertise in like getting the word out. Like I know JRI, they just launched an app, and they have like tons of marketing around it. So it really, they'll talk with the town and be like, what would you like? We have all these options.
Okay.
And you kind of
Okay, good.
yeah,
Yeah.
whoever wants to be like the lead on that kind of like dictates where and how and like best like Facebook or public access TV or whatever,
Yeah, I
so
understand.
yeah, so
What do you think
Yeah.
would work best for Ayer in terms of getting the word out? I mean, this would be an ongoing conversation with JRI or whoever, right? But just preliminary thoughts.
The town website, I would think, would be a location that
Our
would be.
website, I think
Yeah.
that Stone Soup though is a great way to get
Yeah.
word of mouth.
Yeah.
She's on,
moving.
she's
She
on the
is.
Facebook page.
Yeah.
Yes.
She posts every Friday
Yes.
for her meals.
Mhm.
she does.
Yep.
Absolutely,
Yep.
yeah.
On a
Yeah.
lot of the pages I'm on.
Yeah,
which
yeah,
is
yeah.
good. Yep.
Um,
So some of the unofficial Facebook pages for the town and stuff like that.
Yeah, I mean, there's a town,
An official.
group
Yeah.
for Facebook. I mean, as a board, we don't post, I don't think any of the other boards
yeah.
make
Sure.
official postings
Yep.
on it. It's
Yep.
kind of the Wild West.
Yep.
But
Yes.
it does exist.
Mhm.
I've seen it, I'm
Yep.
not on it. But if someone were to post something on there about something going on in town, that would be appropriate.
Great. That's what I usually do. So
Yeah.
I
Yeah.
usually use the Facebook. So.
I would think, though, that Cindy would be an excellent resource in terms of
Yeah.
outreach.
Yeah.
She has.
She's good.
Absolutely.
Yeah, yeah, and I think basically any place
Yeah.
that you find like a hub where people are using, like finding a person in there to like
Mhm.
share that information is really going to be the key to actually like reaching people who are in need.
Right.
Well, I'm sure that you're pretty well tied into this too, but what about the mental health providers? I know that up at the hospital, I know that there's at least one that has several therapists. I don't know
Neshoba,
if there
is
are
that the
others.
hospital?
Yeah,
We,
exactly.
the director, ED director there is part of our coalition, so he's somebody that we
Awesome.
could
Okay.
Yep.
yeah, Gabe Simon, he's great.
Okay.
Yeah, so we should. Yeah, I should probably let him know. Actually, that this
Yes.
is approved.
Oh my gosh, that would be
If they would
wonderful.
be willing to either make information available,
Mm,
that
yes,
someone
yes,
who comes
yes,
in,
Yep.
with
Yeah.
this, I would even be in favor of approaching police and fire.
Yeah,
To,
yeah.
to just hand out, if it's a simple thing they can hand out that has a contact
So we should probably tell Jen about that.
number or email, I think that would be
Jen,
great.
there's so many Jens.
Which Jen?
Jen Bigelow.
Ah, yes,
Yeah,
that
Jen.
one. Yep.
She's also part of the coalition.
Yeah,
She's,
yeah.
She's like working to like set up a leave behind program and things like that
Great.
too. So she's on board, I think, for
Yep.
the most part. And then both the Shirley PD, I think, would be like key
Yeah.
too.
Yeah, exactly.
So-
And whatever Devon's has, I think,
Yeah.
too. would
Yep.
be-
What does Devon's have? I'm always so confused.
Devon's does have their own police, is that correct?
They have their own
Devon's is not a town.
fire.
There
Yeah.
are still 351 towns in the state of Massachusetts. Devon's was a convenience when the base closed that Mass Development stepped forward and said, we'll take the lead. And from closed military bases, Devon's has far exceeded the redevelopment of anything. I almost want to say nationwide. And a lot of that is
It is
due
pretty
to
amazing.
That's
Mass
pretty cool.
Development. We toured Westover Air Force Base when they were closing Devon's, and there was trees that were growing through buildings because
Wow.
there was no cooperation
Holy cow.
between the community and the federal government.
Yeah.
And the federal
Sounds
government
right.
just walked away. They just said, "We're
Wow.
done."
Yeah.
So
Wow.
Mass Development has helped this area tremendously.
Yeah.
So who do you get, if you call 911 on Devon's, who do you
I
get?
think you get the state police.
Yeah.
The state police have
Okay.
jurisdiction on the base.
Okay.
But the
They have their own fire.
They
right?
do.
They do.
Yeah.
But I think that there was a 20-year agreement that was signed with
Okay.
Mass Development that's going to be coming up fairly soon.
I heard
Yeah.
that.
Yeah.
What
They
the
may like-
disposition is.
Oh.
Because
Oh.
part of it
It
was,
might be returned, right? From what I heard. They
I don't think, it doesn't make sense because the
It
water,
periodically comes
Well,
up and.
Yeah.
but the water and
Yeah.
sewer is their own municipal
Oh,
service. It's
right.
not tied
oh,
into the
that would
town.
be very
Yeah.
difficult.
So if
Yeah.
you reconfigured Shirley, Ayer, Harvard, and
Mhm.
Lancaster, it would be a nightmare. you
Mm.
know?
Yeah.
But I'm sure there's people that think that having it go back to the communities that it was would be beneficial. But I'm
That
not sure
sounds
where that.
chaotic.
I'm
Yeah.
not sure
Yeah,
where
it
that
certainly does.
Yeah, that sounds difficult.
Yep.
Oh, jeez.
But we thank you for your.
Yeah, thank you.
Yeah,
Thanks for your
that's
time.
And
Yeah.
look forward to working with you.
Absolutely.
Cool.
Yeah.
Great.
Thank
yeah.
you very much.
We're fortunate to have people like you out there
Oh,
doing
thanks.
this work, because
Yeah, yeah.
we're not really
Yeah.
capable of doing these things,
Yeah,
so.
no,
Right.
we appreciate your support though.
You're really
Definitely.
So you are doing
Yes.
some of these things
Yes.
by supporting it. Yeah.
Yep.
I think
Yeah.
that's great.
Yep.
Okay,
Cool.
good, I feel better.
So the form letter, what would you like me to, would you like me to email that to you, Steve?
Sure, and I'll get it to Trish and to Pam.
Okay. And then I'm just gonna, would you like me to be the contact person on there? Or, oh, I gave it to you, I'm sorry.
I think that would make sense because you're probably more available than, unless Pam or.
Well, I'm thinking that she will know what to do. if
Absolutely.
someone-
Yes,
I have
yep.
a clue what to do
Well,
if someone contacts
And like,
me.
I will plan to be in communication with you guys, letting you know as they
Yep.
progress along the steps
Great.
of whatever those are, and consult with you as needed, anything specifically air related that I can't get myself, right? So,
I don't want to overreach here, but Robert, would you like to be on that distribution list?
Yeah.
I mean, you're central to communications in the town.
Yeah, I think
would
that
you-
makes sense, yeah. Mr.
Would you
Chairman.
mind including our town manager on that list?
not at all.
That's a great direction to go in, because I was also kind of thinking something similar, that
Can I get your email
selectmen
address,
may
sir?
want to know.
T
I mean,
as
I
in
wouldn't want to be
tree,
blindsided
M
if I were the
as the town
selectman.
Well,
manager,
What is this
TM.
needle exchange?
That is something that
So-
I mentioned they usually like
Dot
either get
MA
a Board of Health approval and then go to the
US.
selectmen or something.
Yeah.
Let
Pretty
them
short and
know,
sweet.
you know?
Good, perfect.
I think
Yeah,
that's a good
exactly.
All right.
process.
Yeah.
Yeah.
It might even be
Yeah.
worth it, well, we don't have a very potent newspaper anymore. We have
It's pathetic.
I was gonna
yeah.
say, it might be nice if they could get someone to interview or
Mhm.
come out and take pictures of the van and what else is offered besides just
Totally.
that. I
Yeah,
know
yeah,
I
yeah.
sound like a broken record
No,
with
I
that, but
understand
I know
how
how the other
this-
side is gonna feel
I
about
understand
it.
Yep.
how
Yeah.
these smaller towns operate.
Yeah.
I'm from a really small town, so
Yeah,
like,
okay.
if
Well, and I
You know
think
the
like
drill.
Yeah.
the brilliant part about this is like the calling it syringe services, because that's the contentious part, really only has to happen here, and we can from here on out call it mobile harm reduction services,
Yeah.
because that really is what it is.
Right.
You're
Yeah.
just voting on
Yeah.
the contentious part of it, that's all.
Yeah, yeah, yeah.
Right.
Yeah.
Um,
Right.
Yeah, I would just call it mobile harm reduction. I think
Yeah.
that's a much more palatable way.
And I've talked to
deal with it.
like APAC, I feel like APAC would probably, do you think APAC would be interested in
You know
doing a
what, they
thing on it?
might,
Yeah. Mhm.
do a little piece on that.
Yeah, yeah.
That's worth looking into.
Yeah,
Do you
that
have
could be
their,
good,
do you have their,
I have contact info for a Scott.
Yeah, Scott
Is that-
Berlin.
Scott
Yeah.
Perland.
Yeah.
Okay, great.
Yeah.
Perfect.
And do you think Berlin too is like maybe, or do we not? Yeah.
Berlin is considering it. So I don't believe they've brought it to their Board of Health yet, but their social services person and chief of police are kind of leading the charge on that, and I'm like a little hands off
Good.
at this point. So
Good.
yeah.
So that's
Mhm.
another one that will maybe kind of.
So it's
hopefully
another
something like a
Neshoba town that may be
Yeah.
looking at.
domino-esque effect.
Yeah.
Not all of them, but yeah.
You may want to reach out to our fire chief, Chief Johnston,
yeah.
because they come in contact with people
Yes.
that may be in need of services on a first-hand basis.
Yeah, that would be a good place to connect.
And probably PD too, right? So well, we're going to talk to Jen.
Yeah,
So
yeah.
Jim
Yep.
is an EMT as well, so
Oh,
excellent.
she interfaces with.
Oh,
does a lot.
perfect.
Yeah.
She really does.
She's in the schools too.
Yep.
yeah, I was gonna say
Yeah.
she's in the schools. I knew that. That's how I met her originally.
And she's
then
deputy chief now,
Yeah,
right?
she's
Yes.
deputy, and she's the EMT. Busy.
Wow.
So cool.
That is cool.
Yeah, she's great.
So what I'm going to do is I will print and sign the letter I will scan it and email it to you guys, and then you can
Right.
sign it, whatever, get it back to me, and once we have the certified minutes, I can send all that to Biddles.
Do you need all 3 signatures, or can one person sign on behalf of the board? I'm just trying to simplify.
I
Yeah,
believe
same
that
way.
only one I think it only needs one signature, and I think in theory it only
That's you.
needs, yeah, I'm gonna sign it too, since I'm putting my contact
Yep.
info on it,
Mm,
and then
yeah.
I'm gonna have like a,
But if you let me know when you have it, I'll stop by and sign it, and that way it'll expedite it.
excellent, sounds like a plan to me. Thank you
Awesome.
very much.
Thanks
It's
so
really
much.
exciting,
Thank you.
guys. Appreciate your support.
Cool.
This is so great for this region.
Yeah.
Sorry for
I
keeping
think
you
so,
waiting.
too.
Oh,
Oh, no,
yeah.
don't worry about it.
No big deal.
We had lots of great conversation.
Yeah, and coffee. so,
And coffee.
Yeah.
Coffee, yeah.
All right. Have a good night.
Thank you.
all.
Thank you.
Take care.
So because it's on the agenda, I'll ask if there's any public input, and obviously there's not, so, but we did cover that. Did you want to make mention of a former member of the Board of Health?
Yes, I will let Trish go, and then if we're gonna move from there into Neshoba, it will be perfect, because I have something for Neshoba that also ties in.
Okay.
I'm not sure of the date. I know a lot of people in the town of Ayer already know this, that Mary Spinner passed away, and
Yes.
Mary was on the Board of Health, I don't know how many years, Pam, way before I
Many
got here.
terms on board.
I know she was on
Yeah.
many other boards serving the town for
Yeah.
20-plus years, probably, at least.
Easily.
Committee.
Yeah.
Easily, maybe
Yes.
30 committees.
I know.
I remember there was, what she had Mary Spin, and then she had a little, a show, a little program on,
The town
the
crier.
town, the town
Oh, the
crier.
town crier,
Yeah.
that's right.
So she was
Yeah.
really, really, invested in the town of Ayer for many, many years, and she was a retired nurse, and she was tough and opinionated, but she really had the town in her best interest when it came to
And she did.
serving, and, yeah,
Yeah.
yeah. And
She was a tough, smart
She-
lady.
yeah, she
and
really
knew
was.
where she stood, and I
Yeah.
appreciated that.
Yeah,
I
I did
always
too.
did.
And you knew where you stood.
I think everybody knew where they stood with Mary, but we just wanted to
Yeah.
acknowledge her passing, and that she will be missed.
Yeah, a big thank you. She taught me a lot about
She did.
Board of Health and what it
She
does.
taught me too.
and-
She had a lot of knowledge of regulations that would
Exactly.
stop us and talk about things, yeah.
And she had such an amazing historical memory.
Yes.
She could go home to her notebooks and she'd say, I remember about 7 years ago, this came up, and she would find the notebook and she would have the information.
And she was right.
She was right.
She knew.
Yeah. Yeah,
So,
yeah, she was quite a lady.
yeah, we wanted to mention that.
Yeah,
Before we go on. Yeah.
Well, I actually have something that, is Bridget calling in, or?
She wasn't, she had another
Okay.
obligation at 5 o'clock tonight, so.
I could have just sent Bridget the link,
Oh,
but to pay actual physical homage to Mary, I brought the newspaper.
oh my goodness.
There is a fascinating article on the front page of the Boston Globe. Do you know where your chicken wings come from? And it's very interesting. I'm wondering if, because it talks about a lot of towns near us, Chelmsford. Apparently there's a big thing with virtual restaurants. And you do your pickup at a regular, well-established restaurant. Like, for instance, in Chelmsford, there were 6, in addition to Bertucci's, they also had pickups for 6 virtual places there. And there are a couple of examples in here. It seems like in every case, the Board of Health is going, what? Who are these other places? So this seems to be something that's completely catching boards of health by surprise. In Lexington, they found out about this by the health inspector noticing there was a French fry on the floor. And that restaurant doesn't serve French fries.
Ah.
And it turns out that these things can be made off-site and just dropped off there. So I You know, so it goes on to say, the city of Boston, they're aware of it, they're not planning any big regulations for it. But it's just great because there's some, other local, towns near us that, it was Lexington, it was Chelmsford, Needham, and I know there was one other town, and I can't seem to find it offhand. But I'm going to send Bridget a link to this if you're
Sure.
all in agreement. And I'm just curious to know what if anything, are we doing about it?
That's a good segue into one of the things that I was going to
Yeah.
bring up from the associated meeting last Thursday.
Yep.
One of our topics, and I talked to Robert about this tonight as well, was food trucks
Yeah.
and the vendors. Well,
Yeah.
they are required by law to be inspected by Neshoba if they're going to be operating in town.
Operating in
there.
town.
And they have a permit that should be visible. And
Okay.
in terms of enforceability, if you have a question or you see a vendor, you can certainly ask for a copy of their license. And
Yeah.
we talked about this, other towns, the members of the board, if these trucks show up in their town and they don't know about it,
Mhm.
they're asking to see their permit.
Yeah.
It was also suggested that if you decide to do that, or if I do, you may want to ask the police to go with you if you do something like that. But if you see a food truck that shows up someplace and you think there's a question,
Yeah.
from a public health perspective, some of these places are attached to restaurants, and the restaurant prepares the food, and the restaurant would be inspected by the Board of Health and licensed.
Yeah.
In some cases, people are preparing the food in their house
Yeah.
and bringing it to the truck and selling it.
Yeah.
So it certainly got my attention that if I see something that I'm not comfortable with, I wouldn't have any question about just, do you have a permit? Bridget was telling me this morning that there used to be a sticker that went on the back of the vehicles that shows they were inspected. But the operators were erasing the date on it, so you couldn't see when it was. And I'm not trying to
Always something.
I'm not trying to belittle
Yeah, no,
the
I-
trucks, but
Yeah.
it's something that I certainly would be more aware of if I see
Yeah.
a food vendor that I
Yeah.
just kind of shows up. I have no qualms about
Yeah.
asking to see their permit. And Robert had mentioned to me that the town may be looking at developing more regulations as it relates to food trucks coming in.
Yep.
I'm not sure it's been a problem in here, but it's been a problem in Devon's because they have these
Mhm.
Oh,
huge
yeah, they
events.
do.
and
Yeah.
The vendors just
yeah.
show up.
They do. They
Yeah.
do have a lot of events.
So, thank you for.
No, it is kind of related because one of the cases that they cite from Needham was a Thai restaurant that the Board of Health had shut down for unsanitary conditions. And apparently that restaurant popped up again as a virtual where you just went somewhere to get the pickup. So it's the same people
Okay.
cooking the same stuff in the same place,
Wow.
but now we're virtual. So
Wow.
it's. I think the people from Boston are right when they say that it's new. It's new. We're all kind of sorting the
Yeah.
DoorDash, Grubhub thing
Yeah.
out. So I don't think it's reasonable to expect someone to jump right on this, but I just kind of wanted to make sure it was on our
Interesting.
radar.
Yeah, it is. And this is
I'll include you guys on the link. I'm just
Yeah,
gonna find
and
a
this
link
is
to
the time of
article.
year, when 4th of July and
Yeah,
Labor,
yeah.
when you have those big crowds that attract the food trucks, the barbecue
Yeah,
and all that stuff.
yeah, that's
so.
true. That is true.
Moving on to one other item, maybe a couple more items, but thanks for bringing it up.
Sure.
There is a hearing tomorrow night of a preliminary subdivision plan. And we are listed as one of the interdepartmental commenting boards as it relates to subdivision development. This is from the town planner,
Okay.
the town of Ayer, as you can see, Board of Health.
Yep.
And primarily, the Board of Health's, I guess, standing or issues as it would relate to subdivision is on septic system development and wastewater. So the proposed development is tying in, the proposal is going to be to tie into the air wastewater treatment system that goes on the back of Sandy Pond. I happen to have been on the Board of Selectmen when the line was put in, so I'm familiar with the development and the whole area. The water in Sandy Pond prior to that septic, the sewer going in,
Yeah.
by August it would be green. It was,
I didn't.
it was green, and
During
it
those
is a
years.
public
Wow.
beach.
Yeah.
We would have problems with E. coli. That has gone
Yeah.
away as a result
Yeah.
of the septic being
Right.
changed. But the interesting thing is that when the line was put in, people were not required to tie into it. If you wanted to tie in, you could. So as a result, there are still many, many on-site disposal systems that go around the back of Sandy Pond.
Okay.
And part of the caveat when the line went in was that if your system failed, which falls under the Board of Health,
Yeah.
you could not fix it. You had to tie into
Have
the
to tie
tank,
in.
which makes sense.
Yeah. Yeah.
No one knows how many of these houses are tied in and how many aren't. I know of 3 at the very beginning of the road that are not tied in. They had on-site disposal, and they're, until it fails, they're going to stay with that.
Okay.
But if that line is taxed because of a subdivision, it may not give the people that exist there right now
I see.
the ability to
Yeah.
tie into sewage.
Yeah, I see what you're
So
saying.
I think it would behoove the Board of Health to recommend, not to recommend, to tell the planning board that we want an independent engineer to look at the flows that are on that line, how many houses are not tied in, or how many residents are not tied in, what would be the maximum flow if every existing house is tied in. Now, that line was put in the late 80s or 90s. The amount of growth down there since then has been tremendous in terms of new houses.
Right, right.
So I feel as though from a Board of Health perspective, if someone has lived there and doesn't have the ability to tie in because
Yeah,
we didn't know what the
yeah.
flows were in that line, then it's, right back to
Yeah,
on-site
yeah.
disposal.
How
So
come, Steve, how come, I don't understand that, when you build at any time, how come, we went through this one other time, we were asking for something from DPW for water or pipes or something, and, no, it was, oh my gosh, how many people had private wells? And there was no
That's
record of
right.
that.
Yes.
And we talked to Rick Lindy and somebody else, I'm
Yeah.
like, how can we have a town with people building all these places and we have no record of what kind of,
Well, I think you may have, going forward, you can't put in an on-site system if you have the town sewage. It has to be tied in. But we don't, there's no record that's kept anywhere of someone that said, I don't need town sewage. You know who's tied in. You don't know what
You don't know
percentage
who isn't.
who isn't tied
Right.
in. And if that line is brought to maximum capacity because of the development, then these people will never have the ability to tie in. So my suggestion is
Yeah,
that
to do a study of.
independent
Yeah, I
engineer
understand.
look at what the current flows are, what the flow would be at maximum of all the houses being tied in. How many aren't tied
Yeah.
in? We don't know.
Yeah, yeah.
So that
How
would-
many houses in the development?
don't know. I've got the plans, if you want to take them and look at them. The one
No,
plan,
wait,
one
Is it,
plan.
it's right, is it on Wright Road?
It's on,
it's Stratton?
it's Stratton Hill.
Stratton Hill.
Oh, okay, okay.
One of the plans I saw says 35, one says there's 55. I don't know how many houses. That's going to be coming up at the planning board tomorrow night.
So, my question on that, getting an independent engineer, what does our DPW have for resources for that?
I think we should remove our DPW from having
Completely?
completely and have an independent. And these are part of the planning board requirements that the developer would be paying for it, but the work would be done for the benefit of the town of Ayer. And it would be not supervised, but they would be engaged by the town, but paid for by the developer. And there's other things that are also included. Robert, am I missing anything?
No,
here,
Mr.
or-
Chair, just to add, you're spot on, and Trish, to your
Yeah.
point, so the town has a consultant bylaw, which is governed under the planning board, as the Chair was
Yeah.
mentioning. So in this case, on this issue, the Board of Health could request, and respectfully to the Chairman, I'm suggesting perhaps a letter that could even go tomorrow to the planning board, so it's official. But the planning board can require various consultants for issues such as this,
Yeah.
some others are traffic and what have you,
Yeah.
to do an independent study, so it takes the town out of it, you've got a third party, and,
That's true.
and the consultant pays for it. And so these are questions, as the chair has mentioned, I think are important to be answered. And so they're starting the project process tomorrow night, so it would be good right in the beginning if the Board of Health articulated what it's looking for,
What we expect.
so that can be put
Yeah.
into the plan.
I think it just continued protection of the water.
Yeah.
But more importantly is the people that already live there
Yeah.
need to have the ability to have this service available to them.
Yeah. And this has been, I
It's
said a
been
couple of years, but obviously.
2004.
Really? And so they've hit roadblock after roadblock with this?
No,
Or
they
they just start up and stop? It's not all?
They withdrew and the developer, I think, went someplace else.
Okay.
And now it's coming back again.
Interesting area.
So my comments are intended not to be pro or against this,
Yeah.
but
Yeah, it's
to
just
be
to make sure.
protective.
Right.
Yeah.
And that way there's no,
makes sense.
nobody can say, well, you know, the town has their own opinion through their DPW that said A, B, and C. We found another, you know, opinion. So that takes it away.
So I think a motion would be in order to ask the planning board to have a independent third-party consultant engineer review all aspects of the current wastewater line that goes around the back of Sandy Pond that is proposed to be tied into from this development.
Okay. This is Pam's forte.
No, I'm just,
I look at it and it's like.
I'm astonished at one of these drawings. There's 55, 87
I don't know.
lots up there? Holy.
They're pushing up the hill, right? To go all
Yeah,
the way
yeah.
around. and
This land abuts conservation land in Groton.
Oh, good.
Oh, yeah, it
So you
abuts
go as far as you can around right,
Yeah.
and then they're gonna build
on the
a
left.
connector on the
There's-
left. Okay, got it.
There's many
got it.
other issues besides this, but I
got
think
it.
our responsibility is to make sure that we mention what we're concerned about. So motion, is there a motion to?
Oh, how am I gonna
Well-
repeat all that?
I think an independent third-party agent, well, you're in agreement with
Okay,
that.
I make a motion that the Board of Health ask for a third-party independent engineer on this project through
Stratton Hill.
Stratton Hill through the zoning? No, through the
Planning.
planning board
Planning board.
To assess
to
the
assess.
load on the sewer,
Yes.
impact on the
But also to
sewer and
include
septic.
understanding how many houses are not tied in right now, and if they were all tied in, what would
Yeah.
that flow be? And they can do that.
Yeah. I second.
Second, okay.
I started it.
That's a work cause.
Yes.
So from Robert,
Mhm.
is that a letter that you would write to the planning board and I could sign it, or do I need to write it and sign it?
Mr. Chair, what I would do, once you take the vote on the motion, I would do a draft letter for you on your letterhead.
Okay.
And I don't know what your schedule, if you could come in
I'll
tomorrow to sign it.
I'll do whatever
It'll be
it
short
takes.
and sweet. And then it'll be transmitted, the planning board, it's a public meeting tomorrow, so that way it's right in the gate. So,
Okay.
and I've got the motion here, so
Excellent.
that'd be ready in the morning.
Motion's made and seconded, as stated.
Yep.
All those in
Piecemeal.
favor?
I,
Aye, okay.
thank you.
If you want to take these with you.
No, I was just curious to see where exactly is the situate. Now I get it.
Yeah.
So it's gonna be along you're gonna have to go up a hill
Yeah.
to get
It's,
to it.
like I said, there's numerous issues, but from our perspective, the wastewater is
Yeah,
the most
yeah.
important.
Yeah.
Yeah.
Okay. What else do we have?
I have one question, kind of goes back to, maybe we should have taken it up when we had the harm reduction people here, but what's the best way for us now as a board, since we've just done this tonight, we've approved it, and now the wheels are in motion. I don't want anybody from another board to feel that they've been blindsided by this. Should we send out an email blast? Just to let, people know, let selectmen know that we approved this thing before some constituent calls them up and starts ranting about something and they don't know? I don't know. Suggestions?
This is all new.
Mr. Chair, so I think for,
Yeah.
obviously, Ms. Papineau, you know that as an independent elected Board of Health, this is actually a good project for the town. So to your
Yes,
point
yes, it is, it
on
is.
on the communication, and it's up to the will of the board, I mean, we could put together a brief email, and she may even have it, Jenna, just
Yeah,
an information
yeah, okay.
piece that the Air Board of Health has authorized this, programs, to start soon, et cetera, and we could send that, if the board wants, Carly could do that on behalf of the board to, all the town boards and committees, just so they know, it'd just be an informational piece.
Yeah, that's all.
I think it's a positive thing, I think everybody.
I do too.
But I know what you're getting at, just so
Yes.
everybody's on the same page.
Right. I don't
Yeah.
want anyone on another board to feel blindsided by this. I'm absolutely convinced it's the right thing. to do.
Yeah, oh, I know, and
I
even
know.
like, it's not just the boards, like but she's really good, she's gonna
Yeah.
contact so many people, but
Yeah,
fire and
yeah.
police too.
Mhm.
If somebody calls up
Yeah.
and says, hey, I heard there's gonna be, this van pulling in, and they're like, oh, we didn't know anything
Yeah,
about it. But
yeah,
it
exactly.
sounds like she's
Yeah.
pretty much on top of all that, so.
I think we're
It's fine.
months away from it physically.
Yeah,
Yeah.
oh, that's true too,
Yeah.
yeah, she said 90 days
Well,
before
that's true.
DPH would
Yeah,
even.
Yeah.
and then by the time they issue a contract, if you're, late fall, I would be surprised, or early winter before this actually happens.
Yeah,
That's
things
It's a
get
good-
around.
That's a good point. Perhaps maybe once you get the DPH approval, as the chair mentioned, then we could
Yeah,
send
this is
something
good.
out. 'Cause
Yeah,
it get lost in the
yeah.
shuffle right now. It's just,
Right.
it's
Yeah,
whatever
that's a
the
good
board,
point.
it's whatever the Board of Health wants to do. Just a suggestion from my point. I
Yeah.
think the chair is right. By the time you get, the DPH approval, it'd probably be the
Right.
fall.
Right.
And then that would be the time, I would think, to just notify everyone.
I think that
Okay.
makes
Because
sense.
if you do it
Yeah.
now,
Yeah.
we know it's not going to happen probably till
Right.
the fall. It
Right.
gets lost
Right.
in the.
And then there's a lot of questions too that we can't answer, like, we don't know when, or.
Yeah. And I think it's granted that we're going to get DPH approval, but I
Yeah.
Yeah.
suppose there's always a possibility
Yeah.
we may not. So,
I think it's gonna go through.
yeah.
It's too bad that it takes that long, because now
It is,
the people that
yeah.
really need it, it's gonna be the colder months.
It would be
And
nice
that's-
to have it in the summer.
And also, that's another reason why I said to Nathan, it's to have two sites, whether you go back and
Yeah.
forth, so that it is accessible from both sides of town.
Yep.
We have
Yeah.
to bring, step
Yeah, I gotta think about that too, because the way the town is laid out,
Yeah,
it's the.
but it would have been perfect, Steve, except that's our fire department, that's it. You can't park any
Yeah.
place near there.
Yeah,
I'm thinking maybe there might be some place on Park Street that would be,
Yeah,
yeah, I was kind of thinking Park Street certainly captures people
Mhm.
from up on the hill. You get Park Street, you get, what does that then turn into? Is that Groton Road?
Groton,
Or Groton, is that Groton
Groton School Road
Groton School.
and
Yeah.
Fitchburg Road.
Yeah,
there's that parcel,
Yeah.
I didn't pay attention when they tore down that building, and they planted grass right before
Next to the
family
pharmacy?
pharmacy, there's space, but that's private.
Right.
Yeah.
right?
Yeah, that's true.
But that would be a good spot. Anyways, we
Yeah.
got time to think about it.
Okay, now, yeah, I feel like we
Well,
should
there's a lot of
say
foot
something,
traffic
but it's
because-
probably wrong.
Yeah,
People walk down Park Street to go to the grocery store that's down there,
Yes.
so you
Yeah.
see people walking
Yeah,
back and forth
yeah.
all the time.
Yeah, Park Street has a decent amount of pedestrian
Yep.
traffic.
And with the motel down there, I mean, I think they get a lot
Yeah.
of people that, yeah. So, at the Neshoba Associated meeting last Thursday night, which I really wanted to stick a pin in my eye going to, it turned out to be pretty interesting.
Good one for the team,
No, I was thinking of you, Pam. And it wasn't a kind thought, so.
I bet.
But after kicking around some things that we were talking about, there's some colorful people that are on these boards from other towns that were, it was pretty interesting.
I know.
This one right here, who you made, you know,
Yes, yeah,
what a character he is.
yeah, yeah.
But I think the lady from Bolton or Stowe, or maybe both of them, said, you know, there's been so many things that are going on in other towns that we're not aware of, and things that we're doing that you're not aware of. It might be nice to informally get together sometime, if you want to, and just kick around what is unique in the town of Ayer versus Shirley or Groton or
Yeah.
Harvard. And I thought, what a great idea. So maybe in the fall, there'll be like a coffee or a social type of get-together for members that want to. I think it'd be kind of fun. And
I think it would too,
Yeah.
and I think it would be good to share
Yeah.
what's going on. I mean, even stuff like this with the,
Yeah,
you know,
yeah.
regular restaurants.
Yep.
It's- We can't be the only
Yeah.
town, well, clearly we're not,
No,
it's
no,
thinking
no.
about it.
But it's also
you know.
putting a face with a name when you get the letter.
Yeah,
It's
yeah.
always different.
So
Yeah.
this gentleman who is from Lancaster said, oh, in Lancaster, we have a $10 fee for anyone that wants to put up a porta potty. And they're, really?
Yeah.
Well, everyone else said that too, so there's actually, he said, we want to make sure it's maintained and it's clean,
Yeah.
and
Yeah.
I thought, oh, what a great idea, you know?
Yeah,
So,
there actually is a public health
absolutely.
aspect to porta potties. Yeah.
Absolutely. So that's all I had for tonight, and that was a lot.
It's good though, that's good information. Are you proposing that are you volunteering to work on the porta potty?
I didn't say that. Actually, I think that that's an assignable position.
Oh,
from
here
the
we go.
chair.
Here we go. I know it is.
I think Trish really has an interest in porta potties.
Oh, God. Because I live down by almost to where Rata is. And that's
No, just because I think anybody must be more interested in porta potties than I am.
Anything else to come before the board this evening? Or?
That's all.
Did we
I've
get
got.
an update? I have a question on when you talked to the people at Stewart about the.
Oh, good. No, that's great.
Yeah.
I don't recall seeing anything back from council.
Just I
Yeah.
was reading the past minutes and I'm
Well,
like,
no, that's
"Is what
Right,
happened?"
right.
This has been since April, so.
Yeah, I know.
Let me, through the chair, and I mentioned to the chair, I believe town council has offered an opinion on the next steps. So I will send that to the chair, and if you recall at your last meeting, you'd authorized the chair to proceed, you know, in consultation with
Yeah.
town council. So I'll get that to the chair first thing tomorrow, and then I'm sure there'll be an update as
Yeah,
to
it's-
next steps. But
Yeah.
there was no red light. If you recall, the motion was to authorize
Yeah.
the chair based
Yeah.
on review from council.
Yeah.
So I'll get that information to the chair tomorrow, and then we can proceed accordingly.
Okay.
Yeah, good point.
Yeah.
One other thing
That's
that
good.
came up at the regional meeting was we asked for any seminars or conferences that would be applicable to members of the board to attend. And apparently there's a conservation, they meet in the western part of the state, the central and the eastern. And the conservation component ties directly into the Board of Health, because a bunch of the people that were at the meeting regularly attend this. So Jim said he would send out notification to all of us when there are any seminars that come up that would be applicable to us. You know, as you
Yeah, that's
recall,
great.
we budgeted that in the,
Yeah.
Yeah, that
And
would
the
be
budget
good.
for this year,
It would be
so.
good to know about what's out there. Is that because, does it align Board of Health and the conservation thing because of the sustainability?
I don't know.
Piece of the puzzle, or?
But to your point about sustainability, that came up again from Harvard, and it was again, everyone thinks it's a good idea, but no one knows or thinks that it may fall under Board of Health as it relates to
Yeah.
sustainability.
Yeah, I get that. I get it both ways. It's kind of a fringe
Well,
health issue,
sustainability
but it's certainly
is so encompassing. You know?
exactly. Yeah, yeah. It seems like a very, very broad topic.
But it's something that we are definitely, as a town, are going to have to wrestle with in terms of how do we proceed with that.
Yeah, I know. Exactly. Okay.
Motion to adjourn?
We don't have anything else? We have no bills, action items, or anything for?
Yeah.
No.
Nothing else needs to be.
I think some of those minutes might have to have your signature on, Trish.
Oh, I think they might.
There's some documents.
There's some that I
Carly
signed
gave-
that
gave me that this
were
afternoon.
old. One of them actually was a meeting where only you and I were at the meeting.
wow.
I think it might go back to
Yes.
2020.
Yes.
But we can adjourn, we can sign this. Is there a motion to adjourn so Barry doesn't have to eat?
Oh, yeah, absolutely. I will move that we adjourn. It's 6:39.
Is there a second?
I second it.
Motion's made and seconded. Hearing no discussion, all those in favor?
Aye.